Hello, everyone. Today we're going to be taking a look at trauma-informed care and why it is an essential component of healthcare for AIAN patients. The objectives for today's session are to explain potential barriers to care, such as mistrust of medical systems or geographic isolation, apply trauma-informed principles to care, understanding the impact of historical and intergenerational trauma on health outcomes, and discuss how to engage with Indigenous community leaders and members to understand their needs and perspectives and involve them in the development and delivery of provider training. American Indian and Alaskan Native communities have experienced profound historical trauma, resulting in significant loss of life, land, and cultural identity, leaving lasting psychological impacts across generations. Studies show that AIAN populations experience higher rates of violence, abuse, and loss compared to the general population. Please note that this is a very brief introduction, and the learner should seek out additional information as appropriate. Boarding schools are a primary source of trauma, where Native children were forcibly taken from their families and placed in government-run boarding schools. Here they were often subjected to physical, sexual, and emotional abuse, forced to abandon their languages and cultural practices, and given new, white names, leading to a deep sense of loss of identity and cultural disconnection. Policies like the Indian Removal Act led to the brutal forced relocation and displacement of tribes from their homelands, often resulting in death marches and devastating loss of life due to disease and starvation. Genocide attempts from deliberate efforts to decimate Native populations through warfare, disease introduction, and forced starvation, particularly on the Great Plains where bison herds were nearly eradicated. Historical trauma also includes loss of land by systematic seizure of Native lands through treaties often violated by the U.S. government, leading to loss of traditional sustenance and cultural practices. Active suppression of Native languages, spiritual practices, and traditional ways of life, often through legal means, further eroded cultural identity. In addition, introduction of diseases like smallpox, measles, and tuberculosis to Native populations with little immunity caused devastating population declines. Intergenerational trauma continues to significantly impact the mental, physical, and social well-being of American Indian and Alaska Native communities. Rooted in historical events such as forced removal and boarding schools, this trauma has led to persistently high rates of PTSD, depression, anxiety, and substance abuse. These emotional wounds are passed down through generations, contributing to long-term health problems like diabetes and heart disease. Compounding these issues are social and economic challenges, including poverty, unemployment, poor housing, and limited access to education and healthcare, all of which stem from historical injustices and reinforce cycles of trauma. Recognizing the ongoing effects of historical trauma is essential for delivering compassionate, trauma-informed care to AIAN populations. Mistrust of medical systems among American Indian and Alaska Native populations often stems from a long history of medical trauma, including forced sterilization, unethical medical experimentation, and ongoing cultural insensitivity in healthcare settings. These experiences have fostered deep-rooted reluctance to seek care, even when it is urgently needed, which in turn hinders access to essential health services. A key contributor to this mistrust is the widespread lack of cultural competency among healthcare providers. Many are unfamiliar with AIAN traditions, values, and beliefs, leading to misinterpretations of symptoms, dismissal of traditional healing practices, and poor communication. This disconnect can make healthcare experiences feel alienating or even hostile, particularly when coupled with experiences of prejudice or discrimination. In addition, the limited availability of AIAN healthcare providers and culturally sensitive services makes it difficult for patients to find clinicians who understand and respect their backgrounds. At the systemic level, the Indian Health Service, IHS, intended to serve AIAN communities, often suffers from chronic underfunding and bureaucratic inefficiencies. These challenges lead to inconsistent quality of care and further erode trust in the healthcare system. High rates of poverty and unemployment in AIAN communities can make even available care unaffordable, reinforcing a cycle of avoidance and mistrust. At the same time, AIAN populations remain underrepresented in medical research and healthcare policy, perpetuating feelings of invisibility and neglect. As a result of these interwoven factors, many AIAN individuals may postpone medical appointments, even when experiencing serious symptoms. Mistrust can also lead to difficulties adhering to prescribed treatments or participating in preventive care such as screenings and routine checkups. Geographic barriers significantly impact healthcare access for American Indian and Alaska Native populations. Many live in remote, rural areas far from healthcare providers, making travel to appointments difficult. Contributing factors include long distances, limited transportation, harsh weather, rugged terrain, and lack of access to specialists. These challenges often result in delayed treatment, missed appointments, and reduced preventive care, worsening health disparities in these communities and, at times, leading to false interpretations that the individual is non-compliant with care. So how do we address these challenges? The answer lies in trauma-informed care. This approach emphasizes 4 core principles: cultural competence, trust building, understanding historical trauma, and collaboration with tribal communities. First, practicing cultural competence and humility means recognizing that every patient brings a unique set of experiences, values, and beliefs. It's about learning from your patients rather than assuming you already know everything. For example, understanding the significance of traditional healing practices can help you integrate them into care plans respectfully. Second, building trust and safety is crucial. Simple actions like introducing yourself, explaining procedures clearly, and validating patients' concerns can go a long way. Remember, trust isn't built overnight. It requires consistency, patience, and genuine care. Third, understanding historical trauma and its ongoing effects allows us to tailor care in ways that promote healing rather than re-traumatization. For instance, knowing that a patient may associate hospitals with past abuses can help you approach their care more sensitively. Finally, collaborating with tribal communities ensures that solutions are culturally relevant and sustainable. Tribal leaders and members have invaluable insights into their own needs and priorities. By working together, we can co-create programs and policies that truly make a difference. Some specific practices to consider implementing with AIAN patients are: ask about trauma history sensitively, gently inquire about potential experiences of historical trauma without assuming everyone has experienced it. Focus on strengths and resilience. Highlight positive coping mechanisms and cultural strengths to foster empowerment. Avoid re-traumatization during care delivery. Be mindful of language and avoid asking intrusive questions or making assumptions about their experiences. Provide culturally relevant resources. Offer information and support groups tailored to Native communities. By incorporating these trauma-informed practices, healthcare providers can build trust, create a culturally sensitive environment, and provide more effective care to American Indian and Alaskan Native patients, addressing the legacy of historical trauma and promoting better health outcomes. It's vital to approach interactions with AIAN community leaders and members with deep respect, active listening, cultural sensitivity, and a willingness to learn to gain a clear understanding of their needs and perspectives. Individuals and organizations can foster meaningful relationships with AIAN leaders by prioritizing their voices as experts on their own experiences and issues within their communities. Here are some effective strategies for meaningful engagement. Respectful introduction and acknowledgement of sovereignty. Clearly state who you are and why you are reaching out, explaining your interest in understanding their community's needs. Recognize that tribes are sovereign nations with their own governments and decision-making processes. Before diving into discussions, politely request permission to learn about their community and its concerns. Active listening and cultural awareness. Allow individuals to express themselves fully without interruption and be mindful of nonverbal cues. Ask questions that encourage detailed responses and allow for nuanced understanding of perspectives. Be aware of tribal customs regarding greetings, addressing elders, or appropriate language usage. Prioritize understanding the unique challenges and concerns specific to the community you are engaging with. Establish relationships and build trust over time. Seek out established leaders and tribal councils to initiate dialogue and gain insights into key priorities. Participate in cultural events, powwows, or community meetings to observe firsthand and build rapport with members. Express your intention to maintain ongoing communication and collaboration beyond the initial interaction. Seek expertise and guidance. Consider hiring or partnering with Native American experts to navigate cultural nuances and ensure respectful communication. If unsure about something, don't hesitate to ask questions and seek clarification to avoid misunderstandings. Acknowledge the historical and contemporary challenges faced by Native American communities. Focus on collaborative solutions. Work together to discover common goals and opportunities for collaboration. Seek feedback from a diverse range of community members when developing initiatives or programs. Communicate findings and decisions clearly to the community, explaining rationale and next steps. Recognize that each tribe and community has its own unique culture, traditions, and perspectives. Acknowledge the historical power imbalances between non-native communities. And be mindful of sensitive information shared during conversations and ensure appropriate data protection measures. When developing provider training programs involving AIAN leaders is important, here's how to do it effectively. First, develop meaningful partnerships based on mutual respect and trust. Approach tribal leaders as equals, not as consultants or afterthoughts. For example, invite them to join advisory boards or steering committees to ensure their voices are heard at every stage. Include cultural competency training in your curricula, but go beyond surface-level awareness. Teach providers about the history of AIAN populations, the impact of historical trauma, and the importance of cultural humility. Co-create training materials with community input. Tribal members know best what their communities need, so involve them in designing content, selecting images, and choosing examples. Use delivery methods that respect and align with cultural norms. For instance, storytelling is a powerful teaching tool in many indigenous cultures. Incorporating narratives and group discussions can make training more engaging and relatable. Explicitly address historical trauma in your training. Help providers understand its impact on health outcomes, and equip them with strategies to deliver trauma-informed care. Finally, commit to ongoing engagement and evaluation. Building trust doesn't stop after one training session. It requires continuous effort. Regularly seek feedback from tribal partners and adjust your programs accordingly. These steps ensure that your training remains relevant, effective, and culturally appropriate. Here are some of the key takeaways from our session today. To summarize, AIAN populations experience profound health disparities rooted in historical trauma. Barriers such as mistrust, geographic isolation, and systemic inequities compound these challenges. Trauma-informed care offers a path forward, emphasizing cultural competence, trust-building, and collaboration. Engaging AIAN leaders ensures that care is culturally sensitive and truly effective. Together, we can work toward health equity for all. Now it's time to take action. Commit to one step today. Attend cultural competency training, reach out to local tribal leaders, or integrate trauma-informed practices into your daily interactions. To deepen your understanding, explore these resources, SAMHSA's Practical Guide and the Indian Health Service's Overview of Trauma-Informed Care. Remember, every small step contributes to a larger movement toward healing and equity. Thank you for your dedication to this vital work.
Here are our references.